talking today to Jennifer Lee. Jennifer is a UK physiotherapist and reflexologist. Hi, Jennifer. Thank you so much for letting me interview you today for Askimo TV's International Library of Interviews with Experts.
Very nice to talk to you, Joanne. Thank you for calling.
Pleasure. Jennifer, today we're going to talk about reflexology and toddlers and children. So let's begin with, how did you yourself get involved with reflexology for toddlers?
Well, it was really, I suppose, that I've also got a large family. I have 11 grandchildren and I have 4 children. So being involved with toddlers is not difficult for me. They're now growing up, but I still have a few that are quite small. The other thing is that my research with Prince Charles's Foundation for Integrated Medicine in the 1990s, we found that children with asthma reacted very, very well, and especially the youngest children. We found that the toddlers were the ones who really slept better and their general health improved, and especially they were very good with if they had constipation or something like that. So it wasn't difficult for me to get involved with toddlers, but it wasn't until the mothers themselves, who had heard about my work with research in reflexology, asked if they could learn reflexology in a way that they could do it for themselves on their own children. So we realized that it had to be a formal way of learning, but in a very fun way. So we actually set up reflexologists to be able to teach them. So we teach reflexologists to teach the mothers, and they do a very, very simple way of reflexology. And for toddlers, it's not on the feet, but it's on the hands. And more important, the toddlers learn nursery rhymes so that they themselves can do their own reflex points. So these are very, very important. And this way, the mothers themselves, especially the fathers, can be involved in the treatment of the toddlers.
Explain to me how a toddler can use their hands to, for something like calming themselves if they're upset or for a sore stomach.
Well, for the hand, it's very important to start just teaching the toddler just to stroke their hands. So we do a nursery rhyme called Twinkle, Twinkle, Little Star, how I wonder what you are, up above the world so high, like a diamond in the sky. Twinkle, twinkle, little star, how I wonder what you are. And we teach them to close their hands, not as a prayer, but as actually to say at the end of the treatment.
And for an
if you wanted to do their stomach, we've got a lovely one, which is round and round the garden. And this one involves the whole of the stomach and digestive system, so that the toddler knows if he or she gets a tummy ache, he can do that one and sing the words of the nursery rhyme. All right?
When giving reflexology at home or anywhere, what are some do's and don'ts that parents should be aware of?
Well, the first do is that do give it to your child when you yourself are relaxed and happy, because the child will be very, very sensitive to, especially a toddler. If they feel that you're all tense and irritable, they will draw back. Instead of you having their hands or their feet to you, they will draw away. So that's an important do. And try to do it regularly, because the toddler then knows that something that when mummy or daddy come in the evening, they can tune into their toddler. And he hasn't seen them all day, but he can actually feel that very, very big bonding with their mum and their dad. The don't, though, is don't give it to a toddler who actually starts to be feeling very, very withdrawing, because the toddler may not feel like it. And it's so important that you don't impose yourself on the toddler. The other thing is that you never give it if you yourself are concerned about your child's health. If the toddler's got a bad temperature, or if they've had a bad fall and they bump their head, don't give reflexology until you've checked with your doctor or your health visitor if that's important and that they are feeling all right. And make sure that everyone knows this, that that's very important. We actually get the mothers to sign a consultation form to say they won't stop any medication. Now, this was coming from the research, how important it is not to stop the medications on the child, because we're not replacing anything by giving baby reflex. It's an additional.
Can reflexology improve the health of my child and the bond between mother and child?
That's a lovely question, actually, Joanne. Yes, it does seem to, especially was shown in our research, is that the children loved it. So they started to bond with their parents, and their parents would actually say, do you know, my child is so much nicer since I've given him reflexology. He actually seems to like me better. Now, that was a great start, but it's very, very important that children actually have this feeling themselves that they are relaxed. Because if you get a child that is tense, the relaxation is what actually starts to improve the health. It's what we say the first step, in a rather strong word, normalization of health. By relaxing a child, they will start to allow health to improve. So rather than saying reflexology improves the health, we say reflexology starts to improve the health.
Thank you, Jennifer. Thank you so much for talking to me today.
Thank you very much, Joanne. Thank you.